What is cough? Why does it happen? First and foremost, two main categories of cough: productive and non-productive. Non-productive, also known as dry cough. Dry cough, or non-productive, as it says in the title, does not bring anything up, any phlegm or sputum, or secretions for that matter. Productive cough, on the other hand, we produce phlegm, secretions. The consistency and the colour of the secretions is important from a clinical standpoint to try to understand what exactly is happening in the lung parenchyma itself. Now let's appreciate the lungs in terms of anatomy. I make analogous lungs to a tree, except upside down. So appreciate the trunk of the tree is the trachea, the windpipe over here, that splits over here into the right and the left bronchus. That then further subdivides into bronchioles of various generations. At the end of the bronchioles are the little air sacs known as alveoli. So the trunk of the tree is the trachea, the branches, and then the leaves being the alveoli, the air sacs. Now, if we have any irritant, anything going into the respiratory tract, aside from air, including any dust particles or otherwise any material of any sort, liquid, solid, what will happen, and even some gases in fact, what will happen is this will irritate the lining of the actual respiratory tract all the way from the trachea down and including into the alveoli, and this will initiate a cough reflex. Why? Because the body is trying to expel this irritant that should not be in the airway. It should be nothing but air, oxygen, carbon dioxide, and the majority components of your nitrogen. But any gas, smoke, any smoke that might contain particles, even the smallest, that will cause the person, the individual, to cough, and that cough essentially is a reflex. It's a reflex to expel the irritant in the air. Now when we've got secretions, when we hear the chesty cough, those secretions are usually in the actual alveoli, secretions that should not be there, and that's why when we hear a productive cough you can hear all the secretions either breathing in, breathing out, and that again is needed. The aim of the body is to cough it up and expel the secretions which should not be in the lung parenchyma, and they're occupying an area that should otherwise be clear of any liquids or solids. Thank you for watching.